So if you look at a typical day for someone who eats a plant-based diet, what might a typical menu look like for the day so that they're getting what you talk about, the appropriate amounts of protein and vitamin D and their B vitamins, etc.? Does it include supplements, and can you get everything from food?
You can get everything from food, with the exception of maybe vitamin D.
Okay.
So for the B12, which is only found in animal foods, because we have more people following vegan diets now, it's being fortified or added in other foods like soy milk, meat analogs, cereals. So you can get enough B12 if you're careful about incorporating that in your diet. If you don't get enough of that, you need 2 or 3 servings of those foods a day, then a supplement, either a multivitamin with B12 or a B complex might be indicated.
Okay.
Certainly calcium is one that's a little harder to get, but again, you can get enough as long as you have several servings of leafy greens or things like figs, plant-based foods that have calcium in them. Vitamin D is one that no matter what diet you follow, unfortunately, most people need a supplement because the primary source of that is from the sun. And most of us, particularly in the northern hemisphere, don't get enough sun from October through May to make enough vitamin D. And then even when the sun is at an angle where we can make vitamin D in our skin, we're not outside. We're working in offices, and or we're wearing sunscreen to protect us from skin cancer, which blocks our ability to make vitamin D. So sort of, an overview what the diet would look like, whether you eat 3 meals a day or 6 meals a day, you need to have at least a minimum of 3 servings of ideally whole grains or something that might have B12 fortified in it. So a whole grain cereal. Again, that could also be like a soy milk or a meat analog. Ideally, we say a minimum, and that's if you're doing this gradually, start with at least 5 servings of fruits and vegetables a day, and if you can get up to 9, 10, even better. And ideally, those should be really colorful vegetables with at least 1, if not more, of those being a leafy green like bok choy, mustard greens, broccoli, something like that, which will give you some calcium. And then probably for most people, again, if you're small, your protein needs aren't as high as some bigger men, but most people will probably need anywhere from a minimum of a cup, but maybe even closer to 2 cups of beans or soy products, something like that for protein.
Okay, but that's quite a bit.
It is quite a bit.
Yeah.
And so people have to be very careful, as they move towards this, that hopefully they enjoy beans and soy products. And you mentioned gradually. Another reason to do that gradually is all these foods are really high in fiber, and so if you
overnight will shock you.
Exactly. If overnight you add 3 servings of whole grains, 5 servings of fruits and vegetables, a cup or 2 cups of beans or soy products, you may be very uncomfortable and displeased with the change. So you want to do it gradually.
Okay.
Again, other things to make sure you're getting the things like the B12, the calcium, the iron. Some people will use calcium fortified orange juice.
Okay.
I mentioned the soy milk that's fortified with B12. One of the things that's a little harder to get in a vegan diet is omega-3 fatty acids, or EPA, DHA, which we're learning are important not just for the brain but also for the immune system. And so if somebody's not doing any fish, which is the best source of omega-3s, things like seaweed can be incorporated into the diet to add omega-3s, flaxseed, walnuts, canola oil. So trying to get 2 or 3 servings of those foods into the diet. A day.
Okay.
Right.
Now you mentioned something called meat analog. What is that?
Well, when we use meat analogs for B12, it's the things you see in the grocery stores now that look like meat, but they're not meat. They're made from soy or something like seitan, which is wheat gluten.
Okay.
They're not something I usually recommend people use a lot of in their diet because they're highly processed. But for some people, it can help as they're making the transition. Sort of that gradual approach till we can get them comfortable eating enough beans and other more natural soy products to get their protein. So I'd rather people probably get their B12 from things like whole grain cereals, the soy milk, or potentially a supplement.
I know for us a special treat is to use a meat analog, as you call it, to make vegetarian chili. So you kind of get that texture of meat and the taste of that in there, but you also have everything else that's very good for you in it too.
Absolutely.
Okay.
Yeah, that's a great example.
So one of the things that we know cancer patients, a lot of them suffer from, is malnutrition and not getting enough food, not getting enough of the right kinds of food, and that can affect quality of life, outcomes certainly, survival. Can you speak a little bit to how you address that and make sure that that is not an issue for a cancer patient undergoing treatment?